Hello and welcome to this brief advice training on COVID-19 and smoking. My name is Rachael Taylor, Public Health Lead for Smoking and Tobacco at Surrey County Council. This is a quick training session that aims to inform you about how COVID-19 can impact smokers, provide advice on how to speak to smokers about quitting, and information about the support available from the Surrey Stop Smoking Service, One You Surrey. The Quit for COVID campaign has become the strapline for encouraging smokers to quit during the coronavirus pandemic. So why do we want smokers to quit? Well, we know that smoking causes damage to the lungs and airways, which cause respiratory problems. Coronavirus affects the respiratory system, and smokers who contract the illness are at higher risk of developing severe complications. Smoking of any kind, not just cigarettes, but shisha, cannabis, or any other substances also increases your risks. Smoking also harms the immune system, which means smokers are at greater risk of getting respiratory infections. With high risk of complications, there are increased risks of smokers with COVID-19 require hospital care. The hand-to-mouth action of smoking increases the risk of contracting COVID-19. With households being in lockdown, children, including unborn babies and those with pre-existing health conditions, could be being exposed to secondhand smoke. Smokers should take every effort to protect non-smokers from exposure during isolation. The advice is to smoke outside, at least 7 steps away from the home, and use other sources of nicotine to reduce the amount that is smoked. If you would like further information on the Quit for COVID campaign, here are some links. But please do contact One You Surrey for more information, and details will follow later in the session.
Hello, my name's Luke. I work for Surrey County Council on the Making Every Contact Count programme, or MECC for short. I'm here to talk to you today about Quit for COVID and how to have a MECC conversation around that. It's a bit of background information on Making Every Contact Count, or as I say, MECC, MECC. What is MECC? It's a very brief conversation. In fact, it's the briefest of several possible individual behavioural change interventions, lasting from 30 seconds to no more than 2 minutes, we advise. It's an evidence-based, very brief intervention. It raises awareness, it motivates people and signposts people to get them the help to improve their health and well-being, and directs them to stop smoking services. The important thing to remember is it's not anything more than we are already doing. It's just a skillful conversation to signpost to other services. MECC involves recognising an opportunity to have a conversation with someone about their lifestyle, and in this case, quitting smoking. We need to know what an opportunity looks like. It's the willingness to have that conversation with the person, the openness to hear and be receptive to the information from both sides, which is the important part of MECC. We have to have overall engagement, and we have to look for change talk as opposed to sustained talk. We look for the language that someone uses to support the positive direction of change. MECC is a 3-step conversation structure. When an opportunity arises, we have that simple 3-step structure in place to use to have that very brief conversation. It starts with ask, goes on to assess, and moves on to assist. Step 1 is ask. We ask gently if they'd like to talk about their lifestyle and stopping smoking. If they don't want to talk, in a non-judgmental way, we let them know that they can have the conversation with us or anyone else another time they want. There's no point trying to force it. We're not here to judge, we're here to help. Step 2 is assess. If they do want to talk, we want to explore the individual's views and feelings about smoking using open discovery questions. These are questions that begin with what and how. Some examples are: what benefits can you see to if you were to quit smoking? How important is it to quit smoking? How confident are you that you can make the change around your smoking? What information support do you have to help you stop smoking? And what information and support do you need? The key here is not to give advice, but to actively listen to the needs of the person. Step 3 is assist. We finally ask the person's permission to share some information and support. MECC is not about forcing it. MECC's about getting the person the help they need at the right time. If the person is open and receptive, provide information in an empathetic, non-directive manner, emphasising the best way to stop smoking is with a combination of medication and specialist support. We have a fantastic service in Surrey called One You. We signpost them there. The local stop smoking service is at www.oneyousurrey.org.uk, and we can also give them the further information, Healthy Surrey, which is at www.healthysurrey.org.uk/smoking. The important part of MECC is when to stop. Always remember that if a person doesn't want to talk or doesn't want any information or support from us, we stop. A principle of MECC is that when we give people a choice, recognising it might not be the right time for them. What we've done possibly is plant a seed of change, and another MECC practitioner or someone in the stop smoking service may well pick up on the conversation at a later time. If we're having that conversation at a stressful time with someone, it might not be the right moment to have this ask, assess, assist conversation. It might be that they've got a lot going on, smoking's lower down the list of priorities to give up, but we can certainly pick up at a much later time.
Hello, my name is Barclay and I'm the Engagement Officer for One You Surrey Smoking Service. The next few slides take you through the support available to residents in Surrey and how to make a referral into our service. One You Surrey are Surrey's specialist stop smoking providers and have been since April 2019. We are the only stop smoking providers in Surrey since April 2020, and our service is commissioned by Surrey County Council. In terms of who we can support through our specialist stop smoking service, we support anybody over the age of 12 who lives, works, is registered with a GP or studies in Surrey. We support our clients with up to 12 weeks of combination therapy. This consists of behavioural support and medication, and using our service means you're 3 times more likely to successfully quit than if you were to try and quit alone. This consists of one-to-one and group support. We usually are hosted within community clinics, workplace clinics and GP surgeries. Let's take a look at how our service is adapted to the coronavirus pandemic. Usually our clinics were held either one-to-one or during group sessions. Nicotine replacement was prescribed to the client during these clinics and all prescription requests were given to the client to give to their GP. Since the lockdown was announced in March, all of our clinics are now either over the phone or via video call. Nicotine replacement is now delivered to the client's house, and prescription requests are emailed to the respective GP surgeries. To ensure that One You Surrey is accessible by everyone, we have a number of referral routes. A patient can be referred on EMIS and SystmONE GP medical systems by using the auto-populating referral template titled One You Stop Smoking. You can refer on behalf of an individual. More information on this will be on the next slide. Or an individual can self-refer by visiting oneyousurrey.org.uk, calling us on 01737 652 168 or texting us on 07494 681 070. Once the referral is received, the individual will be contacted within 48 hours. In order to make a referral into One You Surrey, what you'll need to do is visit oneyousurrey.org.uk. Once the tab loads up, you'll see at the top right here, you've got a yellow Get Started button for the patient to refer themselves. If you want to make a referral on behalf of somebody else, click the Professionals tab at the top here. You'll then see a form load up to make a referral on behalf of the patient or client by filling the form below. You'll go through a couple of questions here, including your own personal information, as well as the patient information as well. It consists of just 4 questions, so it should be nice and quick. There's also some more information about other referrals to be made, as well as an ability to download our EMIS referral form for general practice use only. And we also have our generic referral form just here, so if you click on this, You can save this to computer and fill this in on the computer and send it back to us at s.smoking@nhs.net, or you can download the form and fill it in and scan it back to us as well. Let's take a look at what a client might expect when using our service. Upon receiving a referral, One You Surrey are committed to contacting the client within 48 hours and then offering an appointment within a week. Their initial appointment will last 30 minutes with the advisor, where they will discuss how the service works, their smoking habits, the medication available to the client, and then will create a personalised quit plan for them. Over the 12-week period, the client can expect up to 3 hours of contact time with One You Surrey, where they will receive specialist behavioural and medicinal support. Upon completion of the programme, the client will be followed up by us at 12, 26 and 52 weeks post-quit date to ensure they are still smoke-free. If they are not, the client will then be offered an appointment within a week to restart the course. Once at 52 weeks, the client is then deemed smoke-free. However, they will still continue to receive communications from One You Surrey. I'd like to take this time just to thank everybody on behalf of One You Surrey for watching this presentation, but also thank you for all your support up until now. If you do have any questions at all, please feel free to contact myself on the email address below. Thank you.